Thank you all for coming today. Welcome to the Gwendolyn Coffield Recreation Center, to this mental health convening. Throughout the year, we've done a number of things to help lift up the services we have here in Montgomery County, working with many of you in the room. One area that folks were really interested in looking at was early intervention and detection of mental health issues among our young people. We conducted a series of listening sessions, and you're going to get to hear today from some of the young people who are part of those listening sessions.
One of the things we heard from our last convening was that the networking opportunities were one of the favorite, the best things to come out of that. Are happy to be a convener. We know you are the experts in the room, and so again, we want to make sure that you all are connected to one another.
No one knows everything, but together we know a lot. And so please bring in your unique perspectives and experiences and bring it together to build people power.
I have all these amazing adults in the room, their parents, their teachers, their leaders. I want you to tell them what you need.
I think it's easy to talk to friends because most of the time they're more understanding and they're probably going through the same thing that you are.
We're basically understanding each other on a deeper level, on a fresher level. So that's why I feel like it's so much easier to talk with friends.
Because we're humans, we're like ever evolving, trends change, things happen. My biggest issue may not be your biggest issue.
If you controlled the budget for the county and you were able to make an investment in youth, mental health, where would you put your money? Our school has 7 counselors. The senior class alone is 500 kids. And you have to have a meeting, and it's so kind of frustrating because you can't really meet your counselor when you need it.
One of our biggest takeaways was what one of the panelists had said, which is creating programs where parents could also be involved and talk to students or their children.
Parents or adults should get the same resources that we get so they can understand maybe times are different now, and maybe some things that you dealt with when you were younger aren't the same things that we're dealing with.
And I feel like that was really important. There's also more programs with counselors that many MCPS students aren't aware about. If they could just tell us that there is actually more help out there, bridge that gap from the older generation to the newer generation.
Can you talk a little bit about what brought you into the mental health space? What brought you here?
We have a podcast, and that's something that I tell everyone at school. And so we talk about how we're doing. It's something that we can decide on. So every week we can talk about, we had one about homecoming, we had one about what we're gonna do for spring break. I feel like a lot of it is youth led. I can talk about whatever I want. I can ask hey, can we talk about Black History Month? I wanna talk about this, I wanna talk about that.
We go around to people saying, oh, we have this club, it's about this, vibe checkup. It's a mental awareness where we can help students feel safe and comfortable in the community they're in.
There's lots of talk about the impact of social media on youth, but what are some of your opinions about this subject that maybe all of the adults who are talking about it might not think about or understand?
I think that the introduction of social media at such a young age is what a very big problem is. For me personally, I work inside of the middle schools, and there's a lot of drama every single day because people just continuously post about each other and make rude comments, and then they go to school and then they get into fights. And I think giving very young kids, 10, 11-year-olds, phone and access to TikTok and Instagram is what is really causing a problem.
Now with social media, I think people are getting too confident in what they write in people's comments and stuff, and they write stuff that they wouldn't dare say in person because, when you say it in front of someone, you're gonna get in trouble.
Certain conversations need to be had with kids at a young age. One of the panelists mentioned that with their younger sibling, they're already on social media texting their friends. Everybody can see what's on the internet, regardless of what age you are.
And I remember years ago when I was actually at work, I had somebody who was actually reported to me, and they were in my office and they were telling me something. I'm like, well, we could do this. And they're like, stop. I don't want you to solve my problem. I just need you to hear me. And that was actually really important to hear from that person, because then I took it to other places in my life. I'm like, how often do I do that? Do I jump to okay, let's solve this versus just being present and listening? And I thought that was really powerful to hear from the panel.
I think what most parents do, they just go straight to, oh, I'm gonna solve this problem this way because you're not doing this, you gotta fix like that. But if they just come and sit down and listen and then take
listen and take what we say and then try their best. Like I know my mom and my dad try their best to do what they do, but most of the time it's a lot of judgmental feedback instead of actual help.
There was a time when I was younger when I saw the signs of depression without really knowing what depression was. And I saw this in the person I looked up to most, my older sister. How it forced me and my sister apart, creating a distance I didn't know how to mend. The 5 steps on how to help someone you think may be struggling with mental health. The first step is to ask. Ask direct, specific questions and check in on how they're doing and whether they're okay. And keep asking. Step 2, keep them safe. If someone expresses thoughts of suicide or self-harm, take it seriously and reach out for help. Step 3, be there. Listen without judgment. You don't need to know all the answers. Just let them know that pain is real and that you hear them. Step 4, help them connect. Guide them towards resources, whether that's a hotline, a counselor, or someone you know could help. Know that your struggles are not your weaknesses. It is something you are fighting and not something that you are.
Well, I think that concludes our wonderful, amazing young people talking to us. Can we give them a round of applause?
Honestly, I had a blast. Like, I'm so happy to be here. I love talking. I love advocating for things that I really believe in. I think it's selfish of me not to have this opportunity and not take it. Like, I'm really grateful to be here and advocate for people my age.